Hi, and welcome to Dialed In, helping veterans take control of their healthcare. I'm Beth Doyle, a veteran of the U.S. Air Force and an education specialist with the VA National Center for Ethics in Healthcare. As a VA patient, you have a say in the healthcare you receive. One of the ways that VA supports you in making healthcare decisions is through a process called informed consent. Your healthcare providers will help you understand your medical condition and then suggest a treatment or procedure. When they do that, they'll make sure that you're informed, that you have the information you need to help you make the best decision for you. Ray Frazier, Executive Assistant of the VA National Center for Ethics in Healthcare, explains why.
Your healthcare providers want to be confident that you understand the treatment that they're recommending, as well as the alternatives. They want you to have a chance to ask questions about your condition and the risks and benefits of the recommended treatment.
When you agree to a treatment or procedure, sometimes you'll tell your doctor that you agree to it. At other times, you'll be asked to sign a form. Either way, it's the informed consent discussion between you and your healthcare provider that will help you make good decisions about your care. Dr. David Alfondre, a VA physician and ethics consultant at the National Center for Ethics in Healthcare, has some advice on how to participate in that discussion.
Start by telling your healthcare provider what's important to you. You can say, you know what I'm really concerned about? I'm concerned about the number of times a day I have to take this medicine, or the side effect associated with this medicine, or I'm worried about the recuperation you say I'm going to need for this operation. That starts a conversation where the doctor can respond to your concerns, answer your questions, and find out what's really important to you so that you can get the care you need. Because oftentimes there are alternatives, and those treatment alternatives may actually be better at meeting your needs.
Even though your healthcare providers are experts, they'll only know what's best for you if they understand your particular needs and concerns.
Healthcare providers certainly are experts, and they have a great deal of expertise in the treatments and procedures that they may be recommending to you. But you are an expert in you, so you need to be part of the conversation so that you can tell your doctor, yeah, that sounds right for me, or that sounds like something I want for my life. Remember, every patient is different, and some things are more important to some patients than others. So when your doctor knows that, they can tailor a treatment plan that fits specifically for you.
Whatever the treatment or procedure, your healthcare providers will describe it, tell you about its risks and benefits, and discuss alternatives. Sometimes they'll also give you diagrams, pictures, or educational documents. If you want to know more, feel free to ask questions like, what happens if I don't do anything? If I don't take this medication or have this procedure? How should I weigh the alternatives? And, can I have some time to think about it and talk it over with my family? Your healthcare provider will welcome your questions.
Asking a lot of questions means you're interested, you're engaged, and you want to understand everything about the treatment or procedure before it happens. There's nothing disrespectful or problematic about asking questions of your healthcare provider. It's part of the process, it's something they expect, and it's something that will be helpful for your care.
Talking with your healthcare provider can be stressful. Ray Frazier has some suggestions for making sure that you get all your questions answered.
If you're anything like me, you've probably had the experience of leaving the doctor's office and realizing that you forgot to ask a question that had been on your mind. It's a good idea to bring someone with you during your appointment, someone you trust who will ask questions and also help you remember the answers. You might also find it useful to write down questions you have before your appointment and bring that list with you, so at the end of the discussion you can scan down the list to make sure your healthcare provider covered all the bases.
Remember that if you feel rushed, or if you haven't had enough time to think about what's going on, it's okay to ask more questions. It's also okay to decline a treatment that you feel isn't right for you.
If ever you don't understand an aspect of your care, it's okay to slow things down, to ask your healthcare provider some more questions and say, hang on, I don't understand what you're recommending. Remember, this care is about you. And if you don't understand what's going on or why you're having a procedure or treatment, then it's okay to say, stop.
Informed consent is one of the ways that we put veterans first. To learn more about informed consent and your rights as a VA patient, visit www.ethics.va.gov/forveterans.asp. There you'll find the information sheet titled, What You Need to Know About Informed Consent. Dialed In is produced by the Department of Veterans Affairs, National Center for Ethics in Healthcare.